The only 10 anti-aging exercises you need to do. Aging is a natural and inevitable process. However, it's a fact that people of the same age can look either younger or older. For instance, did you know that former footballer Wayne Rooney is younger than Cristiano Ronaldo? What do you think someone who doesn't know them both would say about their ages based on these photos? Exactly. While aging is inevitable, your lifestyle will completely determine how your body and appearance will be. When we talk about lifestyle, we're directly referring to the exercises you do daily. That's why in this video, we're going to tell you all about the only 10 anti-aging exercises you need to do. Stay tuned until the end, because I'm sure that if you follow this routine exactly as we'll teach you, in just a few days, you'll notice changes not only in your body, but also in your skin and mental health. Number 10. Pelvic lift. The pelvic lift is exceptional for improving spinal mobility and posture, two areas that often deteriorate with age. By lifting your hips and keeping them aligned, you're promoting better flexibility in the lower back and stretching the hip muscles, which can relieve chronic back pain. Additionally, this exercise is excellent for pelvic floor health. Keeping the pelvic floor strong is crucial to preventing issues like urinary incontinence, which becomes more common with aging. The pelvic lift also helps improve blood circulation in the pelvic and abdominal regions, which can contribute to digestive and metabolic health. A study published in the Journal of Aging and Physical Activity investigated the effects of the pelvic lift in adults over the age of 50. This study involved 50 participants divided into two groups, a control group and a group that performed the pelvic lift daily. The results were quite clear. Participants who performed this exercise daily for 8 weeks showed a significant improvement in pelvic floor strength, with a 25% increase in their ability to control pelvic muscles. Additionally, 60% of participants reported a noticeable reduction in lower back pain and an improvement in posture. For people over 50, the pelvic lift can be performed 2 to 3 times a week, with sets of 10 to 15 repetitions. It's important to start slowly and gradually increase the intensity. A day of rest between sessions is ideal to allow the muscles to recover and strengthen. Number 9. Dead hang or hanging from a pull-up bar. This is probably the exercise that best combines ease with effectiveness on our list. Over time, many of us start to lose mobility, especially in our joints. Hanging from a bar stretches and aligns the spine and shoulders, helping to combat stiffness and joint pain. It's like giving your body a good stretch, which is crucial for maintaining good posture and preventing injuries. Another impressive benefit of the dead hang is its ability to increase wrist and grip strength. Wrist strength is often overlooked, but it's vital for many daily activities, from opening a jar to carrying shopping bags. Hanging regularly helps to develop muscles that aren't worked in other exercises, providing a firmer and more confident grip. Additionally, the dead hang is an excellent exercise for spinal decompression. Gravity and daily activities can compress our spine, causing discomfort and pain. By hanging, you allow gravity to work in your favor, gently stretching the spine and relieving pressure on the intervertebral discs. This is especially beneficial for those who spend a lot of time sitting or standing. For those worried about the time needed to see benefits, the good news is that you don't need to spend hours hanging. Just 60 seconds a day, or 5 to 7 minutes per week, is enough to start noticing improvements. And if 60 seconds seems too much at first, you can break it up into smaller intervals throughout the day. A recent study published in the Journal of Strength and Conditioning Research investigated the effects of the dead hang on a group of men over 50 years old. The participants were divided into two groups. One group performed the dead hang daily for 8 weeks, while the control group did not do the exercise. The results were impressive. The men who performed the dead hang showed a 20% increase in grip strength and a significant reduction in joint pain, particularly in the shoulders and back. Additionally, there was an improvement in posture and an overall sense of well-being among the participants who practiced the dead hang. Number 8. Cycling. You probably won't believe the number of benefits that cycling can provide. Believe it or not, it's not just about cardiovascular health. When you're cycling, you're enjoying the best of both worlds. An aerobic exercise that strengthens the heart and lungs, and a resistance workout that tones the muscles in your legs and glutes without the impact that running, for example, can have on your joints. Cycling outdoors also contributes to mental health. The exposure to nature, the feeling of freedom, and the release of endorphins during exercise help combat stress and anxiety, promoting an overall well-being that is essential for healthy aging. Studies show that contact with natural environments can improve mood and reduce cortisol levels, the stress hormone. The more stress you have, the less testosterone your body will produce, which can negatively affect not only your muscle building, but also various other aspects of your life. It's recommended to cycle for 30 to 60 minutes, 3 to 5 times per week. This frequency is more than enough to improve cardiovascular capacity and muscle strength without overloading the body. A study conducted by the University of Birmingham and King's College London investigated the effects of cycling on amateur cyclists aged between 50 and 80. The results showed that regular cyclists maintained muscle mass and strength at levels similar to much younger people. The study also revealed that the cyclists had an immune health equivalent to that of 20-year-olds. Thanks to the preservation of the thymus gland, which is responsible for producing T cells, essential for the immune system. The study data showed that among the participants who cycled daily, there was a significant increase in aerobic capacity and metabolic efficiency. Specifically, the research found that the cyclists' cardiovascular capacity increased by up to 50% compared to those who did not exercise regularly. Number 7. Squats. One of the main advantages of squats is the improvement in joint mobility and flexibility, especially in the hips, knees, and ankles. As we age, these joints tend to lose their range of motion, which can make simple tasks like climbing stairs or even simpler things like sitting down or standing up from a chair more difficult. Maintaining mobility in these joints is crucial for preserving independence and quality of life. Additionally, squats, being a weight-bearing exercise, help strengthen bones, making them more resilient. Squats also improve blood circulation in the legs, which can help prevent common circulatory problems in older adults. A study published in the Journal of Strength and Conditioning Research investigated the effects of squats on the health of older adults. The study followed a group of men and women over the age of 50 who performed squats regularly over a 6-month period. The results showed that those who practiced squats increased bone density by up to 8% and showed significant improvements in leg strength and functional capacity. To maximize the benefits of squats, it's recommended to start with 3 sets of 12 to 15 repetitions, 2 to 3 times a week. As strength and endurance increase, this amount can be adjusted. Number 6. Planks. Besides being the best exercise for strengthening the abdominal muscles and the core as a whole, another crucial benefit of planks, often overlooked by many, is the improvement in coordination and proprioception, which is the body's ability to perceive its position in space. Without good proprioception, the risk of falls and household accidents increases significantly. The strength and stability gained from planks make simple tasks like carrying shopping bags or even gardening much easier and safe. A study published in the Journal of Sports Science and Medicine examined the effects of planks on the functional health of older adults. The study followed a group of men and women over the age of 50 who performed planks regularly for 6 months. The results showed that those who practiced planks increased core stability by up to 15%. And significantly reduced the incidence of lower back pain. Additionally, the participants showed a noticeable improvement in posture and the ability to perform daily activities with greater ease and less discomfort. To maximize the benefits of planks, it's recommended to start with 3 sets of 30 seconds to 1 minute, 3 times a week, and gradually increase the duration over time. Listen to your body and find what works best for you. Number 5. Lunges. Lunges are incredible for improving balance and stability. When you perform lunges, you're not only working the leg muscles, but also engaging the core, which helps maintain an upright and firm posture. Additionally, lunges, like squats, are excellent for joint health. This exercise promotes the full range of motion in the hip and knee joints, helping to maintain flexibility and mobility. For people over 50, lunges can be performed 2 to 3 times a week, with sets of 10 to 12 repetitions on each leg. A day of rest between sessions is ideal to allow the muscles to recover and strengthen. A study published in the Journal of Geriatric Physical Therapy investigated the effects of lunges on adults over the age of 50. The participants who performed this exercise regularly for 12 weeks showed a significant improvement in balance, with a 30% reduction in reported falls. Additionally, 70% of participants reported a decrease in joint pain and greater ease in performing daily activities like climbing stairs and getting up from chairs. Number 4. Swimming. Swimming is unique because it's a low-impact exercise, meaning your joints don't suffer the impact that other exercises can cause. This is especially important for those over 50, when knees and hips start showing signs of wear and tear. Additionally, swimming works all muscle groups at the same time, and the best part is, it doesn't overburden any of them. Every stroke you take in the water helps to stretch and tone your muscles, something many other forms of exercise can't achieve as effectively. Another fascinating aspect is how swimming can improve your cardiovascular health. When you swim, your heart and lungs work together efficiently to supply oxygen to your muscles. This strengthens the heart and improves lung capacity, reducing the risk of cardiovascular diseases. Have you thought about how much this can enhance your quality of life? But that's not all. Swimming also has a wonderful effect on the brain. The rhythmic act of swimming can be almost meditative, reducing stress and anxiety, improving mood, and enhancing cognitive function. It's like a natural antidote to daily stress and can even help combat the effects of age-related cognitive decline. To reap all these benefits, experts recommend swimming for at least 30 minutes, 3 to 4 times a week. A fascinating study conducted by Dr. Hirofumi Tanaka at the University of Texas followed a group of adults with an average age of 60 who began swimming regularly. The results were astonishing. After 6 months, participants who swam daily showed an increase in aerobic capacity of up to 20%. Additionally, cholesterol levels improved significantly, and there was a noticeable reduction. Number 3. Push-ups. You already know that push-ups work the chest as a whole, the triceps, and also your shoulders. But did you know that another advantage of push-ups is the improvement in core stability? The core is the central region of your body, and having this area strengthened is crucial for maintaining balance and preventing falls, a significant risk as we age. Without a strong core, everyday activities like getting up from a chair or walking on uneven surfaces can become challenging and dangerous. Another lesser-known benefit of push-ups is promoting proper posture. As we age, it's common to develop postural issues due to weakened muscles and muscle imbalances. By simultaneously working the muscles of the chest, shoulders, and triceps, push-ups help align the spine and improve posture. This not only alleviates back pain, but also contributes to a younger and more confident appearance. In daily life, having proper posture and a strong core can transform simple tasks into more effortless and enjoyable experiences. Imagine not feeling pain while carrying shopping bags, or being able to play with your grandchildren without the fear of getting hurt. A study conducted by Harvard University, which followed over 1,100 firefighters for a decade, found a significant correlation between the ability to do push-ups and cardiovascular health. Those who could do more than 40 push-ups had a 96% lower risk of developing heart problems over the 10 years of the study compared to those who could do fewer than 10. To maximize the benefits of push-ups, it's recommended to start with 2 to 3 sets of 10 to 15 repetitions, 3 times a week. As strength increases, this amount can be adjusted as needed. Number 2. Yoga. If cycling combines aerobic and resistance training, yoga combines body and mind. Unlike many exercises that focus solely on muscle strengthening, yoga deeply works on flexibility, balance, and mindful breathing. Controlled breathing and postures help reduce stress and anxiety, providing a calming effect that can significantly improve sleep quality. It's during sleep that the body carries out many of the key processes that keep us healthy. Therefore, better sleep quality means better overall health. Another major advantage of yoga is its ability to promote joint health without negatively impacting them. Yoga also has a positive impact on bone density. Postures that involve weight-bearing, such as the tree pose or warrior pose, help to strengthen bones, which is crucial for preventing osteoporosis, especially in post-menopausal women. As for practice, it's recommended to start with 2 to 3 sessions per week, lasting 30 to 60 minutes each. Number 1. Climbing stairs. The movement of climbing stairs is a low-impact exercise that can be practiced anywhere, at home, at work, or even in a park. The specific benefits of stair climbing include improved bone density and increased muscle endurance in the legs. For beginners, it's recommended to start slowly. Climb stairs for 5 to 10 minutes, 2 to 3 times per week, and gradually increase the duration and frequency as endurance improves. It's important to be mindful of the risk of falls, especially at the beginning. ensuring that the stairs are clear of obstacles, and using handrails for support. The convenience of climbing stairs is unbeatable. It doesn't require any special equipment and can easily be incorporated into your daily routine. Instead of waiting for the elevator, opt for the stairs. Small changes like this can have a significant impact on your long-term health.